So I just want to explain what I meant in my short video. Um, so as doulas, that doesn't mean that I think we should just sit there and go with the flow, because yes, going with the flow is a huge part of our jobs, because birth can change and unfold in ways we don't expect. But I think it's really important for doulas to be artful and diplomatic in how they um, facilitate communication with providers and their clients. So, for example, if I have a client who is hesitant to start Pitocin, though the doctor has recommended it, um, I'm going to sort of go through like, okay, how do you feel about that? Okay, you're not sure you want to do that. Let's talk about how Pitocin can affect you, how it can affect your labor. And then let's talk about, like, with the nurse or with the doctor, if they're there, are there any other options? Like, what are your concerns if we don't start Pitocin? People have an inherent fear, I think, of Pitocin because, one, it's adding something, and two, you hear lots of horror stories about it. But it can be a really helpful tool. And I hope nobody comes for me in the comments about this, but yes, physiological birth can happen on its own, but sometimes we need things that can move things along to keep mom and baby safe. And, at the end of the day, it's up to you and your provider. And as a doula, I'm there to give you an idea of what to expect, pros and cons, alternatives, and even if I agree with your provider starting that, it doesn't matter, because it's my job to say, okay, if you're not ready, then what you need to tell your provider is, I don't consent to that. And I try to make it clear, like, we're talking through all the options. And sometimes I think what I've learned that doctors don't realize at first is not that their patients are looking to me for medical advice, but that they're looking to me for emotional support, informational support, and they either don't feel like their doctor provides that for them, or they feel like, I just haven't built rapport with you. How can I ask you questions? I'm sort of, that white coat syndrome. So yeah, I think that it's really important for doulas to facilitate conversation and be artful in how we present options, and really be unbiased. And for some people, I can totally understand how that's seemingly impossible, because there is also a lot of passion that goes into this job. So yeah, in the comments, feel free to leave me stories or your thoughts on how you help your clients navigate birth. And then, of course, pregnant women, pregnant people, families, feel free to comment on how your doula helped you, or when you think you could have used a doula's help in speaking with your provider about options.